Hey everyone, welcome back. Today, we're diving into pediatric neurological disorders, an important topic that every nurse should understand. We'll walk through common labs and diagnostics, key assessments, reflexes, and some of the major conditions you'll encounter in pediatric care. Let's break it down in a clear, human way. Labs and diagnostics. To start, let's talk about common labs. CBC. Think infection and bleeding. CMP. Focuses on electrolytes, especially sodium. Lead test. Important for identifying lead exposure. Lumbar puncture. Think about collecting CSF. Sometimes you'll hear myelo in related tests. EEG. Used to check brain activity. Urinalysis. Helpful in detecting toxins. Neurological assessment. Assessing level of consciousness is key. Full consciousness equals alert, oriented, and communicating. Confused equals reduced awareness. Disoriented equals not knowing person, place, or time. Lethargic equals sluggish and hard to keep awake. Obtunded equals very dull response to surroundings. Coma equals deep unconsciousness. You'll also check memory, speech, swallowing, coordination, balance, grip strength, and gait. And remember, if the Glasgow Coma Scale GCS is less than 8, intubate. Reflexes in infants. These reflexes are important in early assessments. Grasp, stroke the palm, and the baby grips. Disappears by 5 to 6 months. Sucking, stroke lips, or insert a gloved finger. Disappears around 4 months. Rooting, touch the cheek, and baby turns toward the touch. Fades by 3 to 4 months. Stepping, hold baby upright, watch for walking like steps. Disappears by 4 months. Tonic neck fencing reflex. Turn baby's head, limbs position like a fencer. Gone by 4 months. If these reflexes persist beyond normal, it might signal a neuro issue. Cerebral palsy CP. CP is a result of brain damage, often around the time of birth. Let's go over the types. Spastic CP. Most common 70%. Muscles are tight. Look for scissor gait and pigeon toes. Dyskinetic CP. Involuntary movements. Think toe walking and flex calves. Ataxic CP. Affects coordination and balance. These kids may be clumsy. Mixed CP. Symptoms from more than one type. Other related movements. Dystonia equals twisting and painful. Athetosis equals slow and writhing. Chorea equals quick, involuntary movements. Diagnosis involves history, physical and neuro assessments, and imaging MRI, ultrasound. Treatment. It's supportive and individualized. Speech, OT, and PT. Braces and splints, baclofen or Botox for muscle tone. Anticholinergics, for example, benztropine for drooling. Anticonvulsants for seizures, feeding concerns. Assess posture, muscle tone, and risk of aspiration. Consult a speech therapist. Neural tube defects. These result from failure of neural tube closure. Let's look at the main types. Spina bifida occulta. Vertebrae don't close, but it's hidden. Spina bifida cystica. Meningosal, just meninges, or myelomeningosal, includes spinal cord. Encephalorsal, brain tissue outside the skull. Anencephaly, missing major brain parts, often fatal. Microcephaly, tiny head, under 30 centimeters at birth. Risk factors: folate deficiency, genetic issues, trisomy 13/18 to 21, obesity, diabetes, some meds, valproate, methotrexate, and infections. Diagnosis: AFP testing during pregnancy or physical exams, imaging after birth. Treatment: cover defect with warm, sterile, saline-soaked gauze. Place feet first into sterile bag. Prone positioning to avoid pressure. For fluids and antibiotics, watch for infection and fluid loss. Prevention: folic acid, 400 mcg daily, pre-pregnancy, 600 mcg during pregnancy. Drowning and near drowning. This is a big issue in toddlers and teens. Drowning equals death less than 24 hours after submersion. Near drowning equals survival greater than 24 hours. Assess ABCs and watch for hypoxia and hypothermia. Interventions: CPR, oxygen and 4 fluids, no dextrose, warm environment. Nurses should support resuscitation efforts, comfort the family, and offer social, spiritual support. Intraventricular hemorrhage, bleeding into the brain's ventricles, especially in preemies. Signs: somnolence, bulging fontanelle, absent Moro reflex. Interventions: minimal handling, head midline, ventriculostomy if needed, meningitis. Inflammation of the brain and spinal cord membranes can be bacterial or viral. Bacterial causes: newborns, GBS, E. coli, listeria. Older kids: strep pneumo, H. flu, N. meningitis. Symptoms: fever, stiff neck, arching back, light sensitivity, seizures, vomiting. Brzezinski's sign: neck flex equals hips, knees flex. Koenig's sign: pain when straightening leg. Interventions: CBC, blood and CSF cultures. Start antibiotics ASAP, steroids and anticonvulsants if needed. Ray's syndrome, linked to giving aspirin after a viral illness, affects brain and liver. Signs: vomiting, confusion, seizures, coma. Supportive treatment: fluids, seizure control, insulin, corticosteroids, and diuretics. Head injury ranges from scalp wounds to traumatic brain injury. Assessment: GCS, imaging, loc, posturing, decorticate versus decerebrate. Care: keep head midline, elevate hob 30 degrees. Avoid stimulation. Administer mannitol or hypertonic saline. Prepare for surgical interventions if ICP increases. Prevention tips by age: neonates, support head. Infants, car seats, no walkers. Toddlers, avoid open water. Preschoolers, helmets and pads. School-aged, sports gear, bike safety. Teens, seat belts, no texting, diving caution. Headaches in children. Types include chronic daily, cluster, tension, sleep deprivation, and psychogenic. Management: rule out infections or injuries. Manage stress and sleep. Watch for dietary triggers, nitrates, caffeine. Medications: NSAIDs, antiemetics, triptans, ergotamines, and in chronic cases, propranolol or valproate. Hydrocephalus: CSF buildup in the brain's ventricles. Infant signs: bulging fontanelles, macrocephaly, irritability. Treatment: shunt surgery. ETV endoscopic third ventriculostomy. Nursing care: head support, skin care, monitor for shunt malfunction. Provide family education and support. Lead poisoning. Lead can come from dust, paint chips, or soil. Test children around ages 1 and 2. Symptoms: headaches, nausea, tiredness. If exposure happens, stay calm, call poison control. Don't induce vomiting, monitor breathing and skin. Go to if needed. Prevention: childproof your home. Educate and supervise children. That wraps up our overview of pediatric neurological disorders. As always, the best nursing care starts with understanding your patients and advocating for them. Thanks for tuning in. See you next time.